Greetings to you wherever you may be, and welcome to this edition of the Healthy People Podcast, a production of the South Carolina Department of Public Health. My name is Ron Aiken, and I'm the Media Relations Director at DPH. My co-host for this podcast is the wonderful Carolyn Culbertson. Carolyn, hello.
Hello, I'm so glad to be here today, as always, and welcome to Episode 2.
Episode 2, our goal with this podcast is to spotlight people, programs, and issues of importance to the health and well-being of the citizens of South Carolina. Our vision at DPH is healthy people in healthy communities, and that gets right to the heart of what we want to talk about in depth on a regular basis in this series. Before we get started with today's guest, we're very excited about, we need to do a little housekeeping. Carolyn, do you want to tell the people how they can listen to, like, and subscribe to this and future podcasts, posts, and releases?
Absolutely. You can find podcast episodes on our website at dph.sc.gov/public/Healthy People Podcast. And you can also visit our YouTube channel at SC Department of Public Health.
All right. And now, without any further ado, our topic for today is an extremely important one for the future of public health in South Carolina. Just last month, the South Carolina Department of Health, the Alliance for Healthier South Carolina, and other partners issued the 2025 State Health Improvement Plan, or SHIP, which is the result of years' worth of stakeholder input into what the priorities of our state should be going forward for the next 5 years to be able to move the needle on positive public health impacts in our state. With us today to talk about that report's recommendations and importance is Dr. Karla Buru, DPH Chief of Staff and Deputy Director of Health Strategy and External Affairs. Dr. Buru, welcome.
Thank you so much for having me.
Before we jump right in, as we like to do on this series, tell us a little bit about yourself, your background, kind of where you came from and how you got to DPH.
Sure. So I'm originally from North Carolina, but I spent most of my childhood growing up in Columbia, South Carolina. I first came to DPH, or at that time, DHEC, more than 10 years ago because I wanted to serve a broader population than just the University of South Carolina, which is where I had been working in the health center. At DHEC, I started in quality improvement and project management. I left for a couple of years to work for the state Medicaid agency, which taught me a lot about that aspect of our healthcare industry. And I then returned back to DHEC as the Chief of Staff in 2021. I have the pleasure of working with many of our different DPH programs, as well as collaborating with other agencies. I love working for an agency that helps to protect, promote, and improve the health of everyone in our state. I like to say that we cover everything from babies to rabies, and I love being a small part of that. I really enjoy the opportunity to collaborate with other agencies, helping us to streamline our efforts to better serve the people in our state.
So this is a question we want to start asking all of our guests to start off the interview. Do you remember the moment that you knew you wanted to work in public service? And can you tell us about it?
So I know this is going to sound very cheesy, but honestly, ever since I was a little girl, I've wanted to help people and make the world a better place. Some people grow up playing sports or being in the band. I was just really into community service and organizing events for my school and neighborhood. I didn't know exactly what my future job would be, but I knew it would be serving others, and that's exactly what I've spent my career doing. I've done everything from being the volunteer coordinator at Salvation Army, to volunteering abroad in Peace Corps in Romania, to being in South Carolina state government. I believe that we need dedicated, passionate, and innovative people working within our governmental systems to make them the best that they can be. And I hope that someone in South Carolina is better because of the work that we do.
Well, what we're going to talk about today, the State Health Improvement Plan, certainly touches on a lot of those different goals and engagement and community building. So can you sort of tell the folks how the State Health Improvement Plan got started?
Absolutely. So the SHIP is really step 2 in the process. The first part was the State Health Assessment, or the SHAW for short. That process started in 2021 when we, in partnership with the Alliance for Healthier South Carolina, started identifying all of the data points that would help to give a clear picture of the health status of our state. So while DPH has some of that data, we certainly don't have all of it. So we brought partners to the table and asked them what data they have that helps tell the health story of our state. And we know that quantitative data is only one part of the story. So during the SHAW process, we also had community listening sessions and interviews to collect qualitative data too. More than 100 partners worked together to identify and analyze key indicators to produce the SHAW. They determined what were the best data points to include and how to group them together. And in 2023, the SHAW was produced, giving us the clear picture of health in our state, and it is the starting point for the SHIP.
Got it. So then what was the next part of the process? We want our listeners to understand the scope and the scale of the work.
We brought together more than 100 stakeholders from across the state and different sectors to review the SHAW results and help to determine priority areas where to focus our improvement efforts. There were group discussions around the data presented in the SHAW, and collaboratively, 9 priority areas were selected. Those include chronic health conditions, behavioral health, maternal and infant health, affordable and nutritious foods, safe and affordable places to be physically active, access to high-quality care, income and poverty, education, and neighborhood and community development. We then brought together work groups with community partners to focus on each area. Groups were led by both DPH representatives and community partners working in those priority areas. For example, the education work group included leads from the Department of Education and South Carolina First Steps, as well as DPH staff. So not only were the work group leads from different organizations, but members within the work group represented different perspectives of that priority area. They included healthcare providers like MUSC and Newberry Health, and community-based organizations like Able SC or Sisters of Charity, other state agencies like the Department of Social Services or the Department of Transportation, private organizations like Constellation Quality Health and Blue Cross Blue Shield of South Carolina, and local and county government like PD Rural Transportation Authority and Bamberg Housing, universities like Clemson and the University of South Carolina. I could go on and on, but that would take up the rest of my time, so I won't do that. But I did want to highlight how inclusive and collaborative the process has been from the beginning. We were very intentional about making sure that our relevant partners were part of the process from the beginning. This is critical for engagement, and we know it doesn't always happen, which is why we wanted them at the table and to help us identify the best strategies. For each priority, the groups discussed why it was important to the health of our state, and they determined what intended result they would like to see in our state for that priority area. For example, in priority area 4, the intended result statement is all people in South Carolina consume affordable and nutritious food. This is what we hope to achieve and the outcome we'd like to see in that area. The work groups develop strategies to help achieve the intended result based on what they know is effective in the field.
I think having spent some time with the SHIP document myself as part of the editorial team, looking through it and going through the 9 priority areas, I think they are comprehensive, well thought out, and well planned, and they provide goals and recommendations to achieve those goals that are measurable and actionable, and that also involve more partners than just us. So kind of with that in mind, how will we know moving forward how the SHIP is working?
So the SHIP was developed using the results-based accountability framework, which utilizes 2 types of accountability measures. The first are population measures. These focus on the well-being of the whole population and is bigger than any one program or organization. It shows us our collective impact. For each of our SHIP priority areas, the work groups identified 3 or 4 headline indicators, which will show us if our strategies are making a difference in the population. Those are probably the ones that you read in the SHIP. One example is infant mortality, or the number of babies who die within their first year of life. We know that to change that number, it will require different programs to address different aspects of that issue. This is where the second level of accountability comes in, performance accountability, which focuses on the effectiveness and efficiencies of specific programs or organizations which are working towards impacting the population level indicators. These measures are guided by the questions of how much did we do, how well did we do it, and is anyone better off? And as we move into SHIP implementation, we will work with programs to help develop these types of measures. Keeping the same example from earlier, one example could be the number of clients seen for a newborn home visitation program. This would help show us how much of the program we did. It helps us to look at the reach of that program.
It sounds like from the very beginning, the SHIP team did a great job of engaging subject matter experts and people working directly in the field and also throughout the process. But can you tell us a little bit more about how people can be engaged moving forward?
Great question. There are several ways people can explore more or get involved. First, if you're interested in learning more about the SHAW data and what it looks like for your community, I encourage you to check out the South Carolina Health Compass on our website. It's a series of interactive dashboards that contain over 120 health indicators based on the 7 data chapters featured in the SHAW. They display health indicators with maps, trend analysis, demographic breakdowns, and comparisons to the Healthy People 2030 goals. It is a great tool for individuals and organizations working on community health assessments and health program planning. It'll be updated more often than the SHAW and provides data at different levels. If you want to learn more about the results-based accountability framework that we use for the SHIP and how it can be applied within your organization, check out trainings available through our community partners, including the South Carolina Area Health Consortium and others. And as we move towards our next steps of implementation, we'll be hosting information sessions for individuals and organizations to get involved in the SHIP implementation work groups. We want to know the work that you're already doing that helps contribute to these priority areas, and if there are strategies in the SHIP that you aren't doing but are interested in learning more about or implementing within your organization. We will continue bringing together partners to collaboratively and innovatively implement the strategies identified in the SHIP. Our hope is that organizations and coalitions all across the state can use the SHIP to help with their strategic planning efforts. For example, the South Carolina Department of Public Health is finalizing our strategic plan. And as part of that process, we mapped out the pieces of the SHIP that our agency could contribute to, and we want others to be able to do the same. I encourage people to reach out to us at livehealthysc@dph.sc.gov to learn more or get involved.
Now, that's a term, the Live Healthy SC, that I have heard a lot and read a lot when it comes to this particular report. For those who may not know, can you tell us a little bit more about that?
Sure. Live Healthy South Carolina was created in 2017 as a collaborative effort between the South Carolina Department of Public Health, formerly DPH, and the Alliance for Healthier South Carolina. It was created to help lead efforts to assess and advance the health of everyone in South Carolina. Underneath the Live Healthy initiative umbrella are things like the SHAW and the SHIP. Live Healthy SC helps to bring together people and resources.
Who should read the SHIP and why?
I encourage anyone who's interested in learning more about South Carolina's health priorities to read the SHIP. However, it can primarily be used for those working on community health improvement plans, community coalitions, and organizations that are planning health programs or grant activities, and it can be used by those working in state and local government or elected officials to help inform health policies.
Dr. Buru, I just kind of wanted to touch on, we've covered a lot of ground, a lot of the different priority areas in the process. Is there anything that maybe you wanted to add that we didn't get a chance to touch on during our conversation so far?
That's a great question. So many things about the SHIP I love. I think one of those is a reminder that the SHAW is a snapshot in time. And so it provided that 2023 review, and that's what we based our SHIP off of. But we will continue to monitor all of the things that we've said we will look at. So all of those headline indicators, we will track those. We will track the progress that folks are making. And if we need to make tweaks in the future, we will. And so we want this to be a living document that our state is continuing to work towards. We also know that things may change. We don't know what might happen the next couple of years. So we'll keep those factors in our mind as we're moving forward together as well.
In fact, if you want to view the SHIP and the state health assessment, you can go to livehealthy.sc.gov and find it right there. Dr. Buru, thank you so much for your time today, and thank you for joining us.
Absolutely. Thank you so much for having me.
It was our pleasure. Carolyn, where can people look for new episodes of the series?
Well, first of all, wherever you found this one, and they're also available on our website at dph.sc.gov/public/Healthy People Podcasts. And please also subscribe to us on YouTube at SC Department of Public Health.
Thank you. Carolyn, any final thoughts about today's topic and guest?
Thank you so much, Dr. Buru, for being here with us today. We really appreciate the passion that you have for this work and everyone on the team. And y'all are all charting a new course for South Carolina with the SHIP.
I like that. We could probably use a lot more nautical imagery here and run afoul of people's sensibilities. I'll try to refrain from doing that, but I'm also grateful for this topic. It's something that when you think about South Carolina as a state and where are we going, you have to have a roadmap. You have to have a course. You need to be able to navigate how to get from point A to point B. And what the State Health Improvement Plan does is provide that in a thoughtful, comprehensive way. And so I would encourage anyone listening to engage with this document and make it a part of your understanding, especially if you're in the healthcare field. It's available on our website. It's very easy to find, and it's very accessible. And the data can be used, as Dr. Buru said, for a great number of reasons or uses that can be put into place at the community level to better understand the issues around you and how to move them forward so that we can create the positive, healthier South Carolina that I know that we all want. Again, Dr. Buru, thank you so much for your time today. And thank you for listening to the Healthy People Podcast, which is a production of the South Carolina Department of Public Health. For Carolyn Culbertson, I'm Ron Aiken saying be healthy, be well, and we'll see you next time.